Good afternoon, everyone. Thanks for joining us for the COVID-19 update for today, May 26th. Oh, hard to believe, isn't it? I'd first like to start by thanking everyone in central Newfoundland who stepped forward to get tested, and a special thank you to all the frontline workers in central Newfoundland who put their weekend on hold to step up to answer the COVID call. So with that, I'll pass it over to Dr. Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have 4 confirmed cases of COVID-19 in our province. 2 are in Central Health and are contacts of cases associated with the outbreak. 1 is under the age of 20 and the second is between the age of 20 and 39. There are 2 cases in Western Health. 1 is between the age of 50 and 59 and is related to travel, and the other is over the age of 70 and is a contact of a case. There are now 46 confirmed cases associated with the outbreak, as well as 2 presumptive cases and 1 probable case. The total number of cases in our province is now 1,273. There have been 4 new recoveries since yesterday, 2 in Eastern, 1 in Western, and 1 in Labrador Grenfell Health, leaving 93 active cases in the province. 6 people are in hospital with COVID-19. A total of 143,370 people have been tested to date. The investigation into the source of the outbreak in central Newfoundland is still ongoing. The strain of the virus that is circulating in the region has been sequenced and has been confirmed to be B1617.2, the variant of concern first identified in India. This variant is more easily transmissible than the original strain of COVID, and reports have also indicated it may be more transmissible than B117. We continue to see new cases associated with the outbreak, indicating that there is still some community spread. This region will therefore remain in alert level 4, but we will be reassessing in the coming days to see when that can be changed. I caution everyone not to read into the case counts. It's, as I've said many times before, it's not the cases we know about, it's the ones that we don't know. So our assessment is still that there is risk in the area, and so we would like everybody to follow public health recommendations and orders. For anyone under alert level 4, there are 3 key ways you can get help, or you can help, sorry. Get tested, adhere to self-isolation directives, and follow all of public health recommendations. These 3 things were critical in overcoming our last outbreak, and the speed at which we can lift restrictions is directly related to the choices that you make now. And if cases continue to spread, it will prolong moving out of Alert 4. For greater certainty, you must self-isolate if just one of the following apply. If you are symptomatic, if there is a positive case in your house, if you're a caregiver for someone that is self-isolating, if you're waiting for a COVID test result, if you are part of a public advisory notifying that you have to self-isolate, or you are identified by a public health official as a close contact of a positive case. In this case, you must self-isolate until 14 days after your last contact with the person while they were infectious, even if your test is negative. Self-isolation means you cannot leave your property unless you require urgent medical care. If you do not have symptoms and you have not tested positive, you can go outside but must remain on your property. You cannot go for a walk or drive. If you need essentials, they must be delivered to you. And if you cannot self-isolate away from family, everyone in the house must self-isolate. If your COVID-19 test was positive, everyone in your home must self-isolate, even if you are able to isolate away from them. Nationally, the epidemiology continues to improve in most jurisdictions. And there was a 31% decrease in new cases in Canada this week, indicating the country is trending in the right direction. And similarly, we are seeing a decrease in the importation of cases into our province from travel this past week. There is, however, still community spreads in pockets across the country, and as long as this is the case, our risk level for importation is elevated. We continue to focus on getting people vaccinated as quickly as possible. As of the end of Monday, 264,457 individuals, or almost 55% of our eligible population, has received at least 1 dose of vaccine. Right now, it is a balance of building protection against COVID in our population through immunizations while identifying and containing new cases and clusters. We hope and expect that the balance will shift in our favor in the months to come. To update with regard to AstraZeneca vaccine, we are awaiting the results of a study out of the UK regarding second doses, and we hope that to have more information on this in early June. The results of this study will help us with recommendations regarding options for the second dose of those who have received, or for those who have received AstraZeneca vaccine. As a recap, for those who may have just joined, we have 4 new confirmed cases since yesterday's media advisory, and the total number of cases in the province is at 1,273. As it has been said many times before, COVID-19 is a marathon, not a sprint. There will be ebbs and flows, triumphs and setbacks, but we have made tremendous progress and we are moving in the right direction. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald, for that update. Certainly another ray of hope with 55% of the eligible population being vaccinated. This is good news, and I encourage everyone to continue to register for vaccines and get them when they become available. This is the best weapon we have to fight COVID-19. Of course, please continue to follow the public health rules as laid out by Dr. Fitzgerald and her team, and please pay careful attention to the geography in which the alert level 4 is applied, as the rules are different there compared to the rest of the province. But again, vaccines are offering that ray of hope towards an optimistic future, which is not that far away, but it isn't here yet. So please continue to follow the rules. We will get there. We're very optimistic that we will have a reopening plan, as other jurisdictions have put forward to the public within the next week. And we look forward to sharing that with the public so that we can know what our summer will look like, hopefully. So with that, I'll turn it over to Minister Haggie for some brief comments. Minister?
Thank you, Premier. Before I start, I'd just like to comment that this is the closing week of Speech and Hearing Month, and I'd like to give a shout out to our audiologists, speech language pathologists, and all those who work with people with speech and cognitive issues, as well as hearing problems. We've seen the value add that we have from our sign language interpreters here, and I'm sure that we congratulate them on their endurance, having stood with us for the last 15 months. We have seen lower daily case numbers today. Last week we had 78 active cases at this time. We are up, however, to 93. And we started to see hospitalizations in slightly larger numbers than we have had before. Those are, unfortunately, to be expected. In terms of the drivers for our case numbers, those have come from places like Alberta and BC and Ontario. But as their case numbers now drop, we are hopeful, cautiously optimistic, that our numbers will follow suit. There has been significant community testing in the central area, and the other day there were 989 people tested and only 1 positive case found. This is encouraging, but we need to continue with this for a couple more days yet before we can draw any conclusions from that. I'd like to give a shout out as well to the staff of Central Health, who at very short notice put together these testing centres, in addition to the vaccine clinics they were currently running. One of the things that we are unfortunately seeing a little of again are rumours and comments in social media which are unkind. I have been in regular contact with Speaker Bennett, who is the MHA for the area, and he's been working very hard to try and provide information and encouragement to the people of his district, and I think has done a very good job. I think it is important to reiterate a message that Dr. Fitzgerald has repeated more than once, and we all have indeed, about being kind. This is not a time for pointing fingers and for blame. This is a time for following the public health guidelines and putting one step in front of another until this wave, this crest, passes yet again. On the positive side, as has been mentioned, vaccine percentages are going up. We're now over 55% for a first dose. We have nearly 90,000 first dose appointments already booked for coming weeks. And if everybody shows up, we'll pass that magic threshold of 75%. Indeed, we are optimistic that within the next couple of weeks, because of capacity with vaccine deliveries the way they are, we should be able to start bringing forward some of the second doses originally scheduled for late July and August into June to actually increase the other target we have, which is a percentage of those with a second dose. Currently, we sit at 2.1% of the population fully vaccinated, and our aim is to get that up as high as possible. And I believe, as a stretch goal, by the end of July, we could be at 40% of the population fully vaccinated. Again, on a rather mundane plea, if you've had your vaccine, please don't throw your mask on the ground outside. There are bins, and that would certainly help my colleagues in TI and other departments who might have to clean that up, let alone the municipalities. Central Health informed me that if you are actually in isolation and currently have a vaccine appointment, there are areas set aside for you to be able to do this safely, so you should keep your appointment. With that, I will turn it back to Premier and for questions. Thank you.
Thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 5 reporters registered for today's call. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, now that you've looked to extend the current alert level 4 for the area that is in it, what is your recommendation when it comes to schools with students initially intended to go back into schools tomorrow in that area?
Public health and the school district, I guess, will be having conversations. It's not necessarily my recommendation. It's really the recommendation of the Regional Medical Officer of Health and the Public Health team on the ground. I certainly would leave that to them.
Kellyanne, I've spoken with Minister Osborne, and there should be an update, certainly to the school communities this afternoon.
Thank you. And I'm not sure who can answer this, but as hospitalizations are increasing, what is the hospital capacity for COVID patients in the central region?
Thank you. That's a very good question. There are currently 4 individuals hospitalized in Central and 2 in Eastern. The capacity, as I understand it, in Central Health for conventional COVID beds is 12. And my understanding is also that their intensive care unit is not yet at 80% occupancy. I think it's somewhere around 70, but I can get you those figures. So currently there are no concerns around capacity from a hospitalization point of view in that area.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. It appears Central Health was not planning any testing today beyond some pre-booked appointments this morning. Does that mean community testing in the region is wrapped up, or is it still going on?
Yes, so at the moment they are working through those people who had come out to get community testing, so they're continuing that today. And I think, they're certainly looking at a testing strategy, but a lot of that will depend on the results of the tests that they've done today and where they move forward with that. So I think you'll hear more from Central Health if they've decided to continue with testing or not.
Okay, thank you. And do you have any idea yet how many cases in the region are people who have received a first shot of vaccine?
We certainly know that there are cases who have been vaccinated with 1 dose of vaccine, but no, I don't have that information right to hand. But we can certainly get what we have, Peter, and get that to you.
I'd appreciate that. Thank you very much.
Certainly something we're following very closely, Peter, as you can imagine.
Yep. Okay, thanks.
Our next questions are from Jeremy Eaton with CBC. Please go ahead.
Thank you very much. Dr. Fitzgerald, given the arrival of the COVID variant B1617, does that affect the rollout plan for vaccinations in this province, given that I guess it's a more stiffer strain than others?
I mean, at the moment, no. We're just going to continue with our vaccination rollout as we have. Our goal is to get as many people vaccinated as quickly as possible. I think that in the area, Central certainly focused on trying to get second doses to people who are living in personal care homes and other congregate living facilities. But other than that, at the moment, our goal is still just to get as many people vaccinated as quickly as possible.
Thank you. I know that you touched on it briefly in the preamble, but Ontario started offering second doses of AstraZeneca to people who want to get fully vaccinated. I understand that we have about 1,500 here. I know that you said that there will be a study, and I guess that will wrap up early June, I believe you said. So what happens to those doses that we have here?
Minister, do you want to?
Yeah, certainly. We repatriated, I think, 1,400 and odd doses last week because they were going to expire. We still have a modest number in our inventory, but they're not set to expire till the end of June. At some point, Dr. Fitzgerald will have the information she requires as to whether or not it's a 12-week jab for those who already had the first dose of AstraZeneca, or whether there'll be some kind of mix and match arrangement. And that decision, we're not at the 12-week mark yet for those people who had their first dose. So we're waiting on further information and advice from Dr. Fitzgerald and her team.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Dr. Fitzgerald, you said a little bit ago that some of the cases in the central cluster have had one dose of the vaccine. What would you say to people who are worried about vaccine effectiveness upon hearing this news?
So we know that, all the evidence so far is telling us that the vaccines, the mRNA vaccines in particular, are highly effective, but so is the AstraZeneca vaccine. And we do know, though, that the effectiveness is best after 2 doses, and that's why it's so important for everybody to get 2 doses of the vaccine. Cases or infections in people who have had 1 dose of the vaccine are not unexpected in small numbers, and that's what they are, is in small numbers. So we will see them from time to time. What the evidence has shown us so far, thankfully, is that it appears that people who do have 1 dose of the vaccine tend to have a milder course of illness, so they are less likely to have severe disease. And certainly we have seen that here as well. This information is not unexpected, given what we know about vaccine effectiveness at this point. We still have very highly effective vaccines, however. So, it is important for people to get vaccinated and with 2 doses.
Thank you. And Premier, you said in your opening remarks that a reopening plan for the province can be expected within the next week or so. What has gone into putting that together? Who have you been talking to? What have you been hearing? And what else has gone into preparing this plan?
Well, certainly Dr. Fitzgerald and her team and Minister Haggie have been working hard looking at the epidemiology here, looking at the guidance of elsewhere and what's happening elsewhere. As Dr. Fitzgerald has said many times, it's not just the epidemiology in our own jurisdiction, but that across the country that will help us guide our way through the reopening plan. All of those things are being considered when considering how we reopen. Of course, other jurisdictions have been reopening to get to we are today, but they've also gone a step further to look towards what happens when you hit that 75-20 mark. And as Dr. Haggie or Minister Haggie said earlier, we're quite optimistic that we will achieve that vaccination threshold. And so, again, we're kind of very optimistic for the summer and beyond. But again, things can change, and we'll make sure that there is a dynamic component built into that to afford the flexibility required.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland and Labrador. Please go ahead.
Thank you. Newfoundland and Labrador is currently going through a bit of a gold rush, which is mostly based in Central. So, Premier, what kind of impact is the switch to Alert Level 4 potentially having on those operations?
Well, I mean, first of all, most of that is exploratory work, and so hopefully it won't have too great of impact, as hopefully these next couple of days, of course, will be critical, but hopefully we can contain this and move forward. And so, I'm quite optimistic that it won't have a significant impact on any potential gold operations and overall economic activity in central Newfoundland.
Thank you. And to follow up a bit upon that, mining companies are permitted to continue operating in Alert Level 4 as their essential infrastructure. But, on the chance that the central cluster isn't contained and the community spread continues, could that result in new public health measures that might impact the mining sector's operations, especially going into, the key window for summer work?
Sure. Well, I mean, that's a bit of a crystal ball question. Hopefully we can contain this and we won't have to get there. But as you are aware, some mining operations continued even in Alert Level 5. So there are protocols that could be in place to allow for essential mining activities to continue, should it be required. But I'm quite confident that Dr. Fitzgerald and her team, and more importantly, well, not more importantly, but equally important, the people of central Newfoundland will continue to get tested, follow the rules, and we can contain this fairly rapidly.
Thank you.
I will now go back through each reporter to see if you have one final question. Kellyanne Roberts with NTV, do you have a final question?
Yes, other provinces have looked to shorten their isolation, not just for entering a province, but if you are the close contact of somebody who does have COVID. For example, in Alberta, if you have both doses of your vaccine and you are the close contact of someone who's tested positive, nothing changes for you. If you've had one dose, you have to isolate for 10 days and will be tested on day 7. Is the province looking at doing similar measures now that that 75% threshold is now in sight for first doses?
Certainly we are looking at all of those things. We don't have guidance on that just yet, but we certainly are looking at that as, case and contact management as we move forward, and waiting on some direction or some recommendations as well, at our larger tables and to see how that goes. But at the moment, things are staying as they are.
Thank you.
Peter Jackson with the Telegram, do you have a final question?
Sorry, yes, I do. We were talking about this magic number, 75%, which was, I believe, released by the Public Health Agency of Canada as a kind of a threshold. None of their supposed relaxation of measures seems to be anything more than what we already have, though. So can we expect something more than what that document contains when you release your reopening plan?
Well, as we suggested, Peter, we're looking at everything, and Dr. Tam released that model based, I believe it was actually done back in April, so things have certainly changed with respect to kind of real-world evidence and seeing how transmission has been diminished. So we're interested to see how that plays into other modeling. But again, all of these things are things we're kind of considering moving forward. Certainly, I'd be optimistic that if you look at British Columbia's and some of the other plans that we could certainly move towards something like that. But again, that all depends on the evidence available and how Dr. Fitzgerald and Dr. Haggie and others kind of weigh in on this, and in combination with the real-world evidence as we're seeing it evolve in front of our eyes with respect to transmission rates and one dose. So it's certainly a topic that I'll be raising with Dr. Tam on a call later this week, just to see where their heads are with respect to how this plays in the overall modeling of the nation.
I'm sorry, this is not another question, but will vaccine passports be included in that conversation?
I think that's a live conversation with everybody right now, Peter, and I think it's an important conversation to have, recognizing the potential immediate value of it, but it has, of course, be weighed with privacy issues and frankly, future civil liberty issues. So we need to kind of make sure that we're hitting that correct balance when considering vaccine passports. But it's certainly something that will allow for more liberal travel.
Thank you.
Jeremy Eaton with CBC. Do you have a final question?
Yes, ma'am. So, as you just said, Premier, today Alberta is going to release their plan. British Columbia released their very detailed reopening plan. And I know that you said that you'll probably have something for us next week. But what I'm wondering now, does this central cluster and the confirmation of the arrival of the B1617 variant, does that impact that, or does that affect that, or can you still go forward knowing that this is in the province now?
Well, I think I'm confident that we can kind of move forward with recognizing that things can change, but this is about trying to play the position of where the puck is going to be, not where it currently is. And so we're trying to anticipate the future. And certainly as the supply chain of vaccines has been more robust and more reliable and the numbers continue to ramp up, I think that that's a prudent kind of decision-making the matrix that can occur. But again, it's all depending on our own epidemiology here, of course, and then adjacent epidemiology. Things can, if there's anything that we've learned with COVID-19 is that things can change fairly quickly. And so we need to be flexible and dynamic in our approach, as has been built in and baked into the British Columbia plan, as I'm sure you know.
Thank you.
Richard Duggan with VOCM. Do you have a final question?
I do. Going back to the reopening plan again, the Provincial Advisory Council on Tourism was pushing for that July 1st reopening. Our plan will now soon be finalized, which would be about at least within the first couple of weeks of June. Is that enough time for tourism operators to have that reopening by July 1st?
I mean, we would love to have been able to provide plans for tourism reopening in January. But in the balance of the evidence that's available, and frankly, with the current cluster occupying attention right now, I think next week we really hope to be able to provide them with more certainty and a brighter, optimistic, not normal, but as Dr. Haggie said, certainly not a normal summer, but certainly a different summer than last year. And I think that's probably the best position that we can be in right now.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Once again, I'd like to thank the people of Central Newfoundland for following the rules, continuing to be tested, following Dr. Fitzgerald and her hardworking team's advice. This is what will get us through this cluster. And equally, or perhaps more importantly, continue to get vaccines, because that's what will get us through this pandemic. So stay safe, Newfoundland and Labrador, and that's it for today.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.